so much for that. Congresswoman Ayanna Pressley joins me now, of course, Democrat from Massachusetts. Congresswoman, thank you so much for your time this morning. I understand that you've written a letter along with Senators Booker, Senators Warren, Senator Kamala Harris as well. And you wrote this letter, as I understand it, and you correct me if I'm wrong here, to the Secretary of Health and Human Services. Tell me more about the letter. Tell me what you and your fellow lawmakers hope to accomplish.
Well, we wrote that letter on March 27th because history has shown us that in the face of combating any virus, that communities of color are disproportionately impacted. We saw that with H1N1. And of course, we know that communities of color represent a more vulnerable group because they also represent many of those underlying conditions that put someone at risk. And so on March 27th, myself, Senator Warren and Harris and Booker, respectively, sent a letter to Health and Human Services asking them to collect data in real time to disaggregate that data. We have not heard a response from them. There are some states that are already doing this, but we need this to be standardized across the board because it will directly inform how we coordinate and marshal resources. And we know that which gets measured gets done. It will give us those assurances that access to testing and treatment is equitable in meeting the scale and scope of this pandemic.
Hey, Congresswoman, I just heard something there in the governor's briefing. There's a question asked about this sort of racial disparity that we're talking about, and the response was basically they're collecting the data from the coroner's office after someone has been, I guess it's been determined that they've died as a result of coronavirus. Do you know if that's the norm nationwide, or is that unique to New York?
Well, again, that's the point. That's why we sent that initial letter March 27th, because we know what history has already shown us and we understood the risk. And today, myself and Representative Robin Kelly of Illinois are leading a letter with the Congressional Black Caucus advocating for our Democratic leadership to make this a priority. We need standardized testing. This has to be a federal mandate. And not only that we have that, not only that we have that data, but that it is being publicly shared. We are already collecting age and gender. And by collecting age and gender and sharing that data, we now see that we see a higher proportionality of men being represented in this, men of color in particular. And so it is important that we begin to collect this data to disaggregate it and to publicly share it in real time. I would also add, given that communities of color disproportionately suffer from those underlying conditions that make them more vulnerable, like asthma and heart disease, and diabetes. That is why I also continue to fight for our community health centers, because we know that disproportionately that our most vulnerable communities lack equal access to quality health care. And so in meeting the scale and the scope of this pandemic, we have to continue to fight for those community health centers as well.
Congresswoman, while I have you, I want to talk about phase 4 of this stimulus relief, this relief package that's been talked about by lawmakers on both sides of the aisle. Governor Cuomo just basically insisted that to reopen the economy in New York, they're going to need federal assistance. What more would you like to see in a phase 4 of some sort of stimulus bill?
Sure. Well, it looks like we'll actually be gearing up for Plan B of the CARES Act. And then beyond that, perhaps a package 4 that would focus on infrastructure and economic recovery. I know that I consider student debt cancellation to be critical to any comprehensive economic recovery. We need to continue to make federal investments in our community health centers. We need to center the humanity of every individual, family, and worker. And that includes not leaving behind our undocumented and our uninsured. We have to continue to make those investments to support vulnerable populations like those experiencing homelessness. incarcerated men and women. And again, we have to continue to support those small businesses. But those are some of the top lines. We're focused right now on making sure that the CARES Act and its implementation is one that is meeting the urgent need and mitigating the hurt that so many of our families are experiencing, all of our families are experiencing right now. The gravity of it is just of our responsibility in this moment is overwhelming. There's a lot of hurt. And so we have a lot of work to do to meet the scale and scope of that hurt.
Congresswoman Ayanna Pressley from Massachusetts. Congresswoman, thank you for your time. I do appreciate it. Thank you.